One of the most common concerns that I'll hear from people kind of midlife and menopausal age women is that they're just not sleeping as well. It's either a problem getting to sleep or staying asleep. And so the big question is, well, why is this happening to me? This didn't used to be a problem for me. And really, it's kind of interesting because it's hard. We know that midlife and menopause age women do have a higher incidence of anxiety and depression compared to the baseline population. That's not always the cause, but those are a couple things that we'll address in the conversation just to see if that is a component, and that directly relates to sleep disturbances commonly. The other thing too is hot flashes are very common in midlife and menopausal women, and so a lot of times that'll wake people up. They'll wake up in sweats, and then it's hard to get back to sleep, particularly if for that person it happens throughout the night. So you really want to get into that, but also to not forget about things like sleep apnea and those kind of things as well that occur at many, all different ages. And so just to kind of get a general history with that and to try to treat what seems to be the most likely cause of their sleep disturbances. If it's hot flashes, we have a whole plethora of treatments for that, and we know that that definitely improves sleep. We know that. And if it is things like anxiety and depression, we have a lot of treatments for that, and obviously dealing with whatever the underlying cause may be for the patient. And this is something that's really a big quality of life issue, because if somebody doesn't have good sleep, then nothing else really matters. They get increased cortisol levels, which causes weight gain. The other thing too is that in addition to weight gain, that can also cause depression and anxiety. So it's like, what comes first sometimes for these patients? So it's really trying to get to the underlying issue, and particularly addressing it before it leads to other medical health problems for the patient. And fortunately, there are a lot of good treatments. I think with a good history, you're usually able to get a really good handle on it, at least with one visit. Occasionally, there might be a need for a follow-up, and obviously it depends on the patient a little bit. But if you're able to really get a good handle on the cause, help them with some sleep diaries, things of that nature. We prefer to have a follow-up either by phone or by clinic visit, but it's not something that typically will take a long time to work out. There really are that many treatment options. I should mention that one of the big treatments for sleep disturbances is mindfulness, and we're fortunate here at CRMC to have some mental health specialists that focus on using mindfulness to treat sleep disturbances, and that really is a pillar of treatment for sleep problems. The other thing too that we have, if we're concerned about possible sleep apnea, which can lead to a lot of medical problems, particularly cardiac problems, we do have a sleep center and a sleep specialist that we will refer people to, absolutely. In addition to some environmental changes, lowering temperature in the room, those kind of things, fan on, wearing cotton clothing, but a real important one too is more of a lifestyle change. We know that there's a lot of data supporting if somebody exercises 20 minutes a day, 3 times a week, that is directly associated with improved sleep. You can self-refer, just call our clinic line, or you can have a consult from your primary care clinician. We are happy to see either patient.